So this is a little bit of a loaded question because you're going to get different answers from different plastic surgeons. But for me personally, I think that the incision in the crease of the breast is always the right choice. So when we're making decisions for breast augmentation, the goal is to choose different steps of the operation in a way that not only gives you a beautiful result, but also minimizes your chance of complications. So the incision in the crease of the breast is going to minimize a few different complications. So first of all, capsular contracture, second, infection, third, injury to the nerves to the nipple, and fourth, your ability to breastfeed. So I think in my practice, this is what I typically recommend to patients because I want to minimize all those types of complications. It's also not visible when patients heal, and I've had doctors say that patients of certain ethnicities, they don't scar well, and so the areolar scar is superior, but I don't find that to be true at all. The areolar scar is extremely problematic when it comes to tethering as well. So if you have friends with augmentations with scars in that area, you've probably noticed that the scar tends to be quite flat and it can tent in. And this is a really common thing I see with revision patients that have had implants placed in that method. So I just don't prefer that scar. The axillary scar is problematic for similar reasons, but it's also visible if you wear a tank top or a sleeveless dress. And so we often have discussions about this. I just listened to a lecture with a surgeon who does pretty much all axillary access and is very married to it. And he showed all these pictures of women without scars, and they had their arms over their head, and all of them have very visible scars in their armpits. So that's not my preference. Like as a woman, I wouldn't want to have a visible scar every time I wear a tank top. I like it hidden, but to each their own. So for the instance you mentioned here for having a smaller areola, it's not really an issue if you're making the incision in the crease. But yes, you can have trouble if you do want to utilize an areolar incision and your areola is quite small. The implant may not fit through such a small incision, or you may have more trouble getting the implant in, which could be more problematic when it comes to implant damage, contracture, all of those things. So I like the crease incision, as I've said 10 times already in this video, and most of us in my area, that's what we use these days. So talk it out with your surgeon and figure out what's best for you.